Welcome. I'm Dr. Deborah Lockwood from Life Changer with the next in our series of interviews on success in cardiology. It's said that success leaves clues, and here we interview those who have already been extraordinarily successful in our own profession to try and glean these clues from them. It's a real pleasure for me to introduce to you our guest for today. From 1987 until recently, Professor John Camm, or Prof as we all called him, was Professor of Clinical Cardiology at St George's Hospital Medical School in London, where he had an army of research fellows under his supervision. More than half of UK-trained electrophysiologists, including myself, have done at least some of their training in his department. During this time, he has authored or co-authored countless peer-reviewed papers and book chapters, as well as more than 40 books, predominantly on cardiac arrhythmias. He is, however, probably best known for his many wonderful lectures, and in particular for his participation in debates, where it is well known that he can successfully argue for any side of any topic with convincing data to support his argument. Welcome, Professor Camm.
Thank you very much, Dr. Lockwood.
So let's start.
Let me just tell you a story.
Please do.
From your introduction. I once appeared in a debate and I gave my side of the debate. And then my opponent simply introduced a video of me giving exactly the opposite side of the debate. So it was me against me, and he won.
Well, that is lovely. Oh dear, I can imagine that as well. I mean, how else do you argue against Professor Camm? All right, so looking for success that leaves clues. So let me ask you first of all, do you follow a particular morning routine? Or have you always done?
No, quite the opposite. I'm a one day at a time type of person, and I try and make my life fit around whatever obligations I accept and whatever things I have to do. So I don't try and regiment the day at all. I just go with the flow, as they say. I've always found that a much better principle than trying to get up at a certain time of day, do a certain amount of things before I go to work, and so on and so forth. In fact, I'm not a sort of morning person at all. I'm a late evening, even a night owl. I like to work late into the night. I often don't go to bed until 1, 2, 3 o'clock in the morning. And therefore, I don't get up particularly early. I'm not a 5 a.m. or 6 a.m. riser. I'm often quite late getting out of bed, but I try and make sure that I meet my commitments and let my life flow around the commitments rather than trying to be regimented about it.
Mm-hmm. Perfect. So was there any time in that for you to do exercise?
Well, as a younger person, yes, I used to do exercise. In particular, I played a lot of tennis. I can still play a bit of tennis, but not anything like as vigorously as I once did. But most of my exercise, paradoxically, came from running for aeroplanes or walking not only 10,000, but sometimes 20 or 30,000 steps a day, walking around exhibition halls or going to conference rooms and so on and so forth. So plenty of exercise. In fact, I've remained the same weight, for example, from the age of 26 to, as I am now, 77. My BMI hasn't shifted from the somewhat over normal or just the wrong side of normal. I'm about 26 or 27 BMI, and I think it hasn't changed at all.
So have you been someone who's always had a really clear vision of what you wanted for the future, say 1 year or 5 years away, or do you just live it day by day?
No, I don't exactly live everything day by day. I have had a general principle of not being repetitive and not doing the same thing all the time. So I've always tried to do something until I got really to the bottom of it and doing it as well as could be done. And then I would move on to something else. So, for example, originally I was very interested in deductive electrophysiology. That was what was happening in the early 1970s, for example. But I got fed up of that, and I moved on to risk prediction of sudden cardiac death, for example, or of heart failure, or problems related to hypertrophic cardiomyopathy, and so on and so forth, depending on who I'd gathered around me. And often what they were doing would interest me for a while, and so on. And I then moved into atrial fibrillation, then I moved into anticoagulation, then I moved into left atrial appendage closure devices, and so on and so forth. So I keep moving from something that's become pretty well established to something which is just starting. And I try to go with the development of some of these inventions or procedures or ideas. And that's the way that I've kept myself interested in everything as I've gone along. But I would hate to be doing the same thing every day. And I would hate to be doing the same thing for more than a few years for a big subject and then move on to something else and so on. So that's the way that I've conducted things.
So you definitely chose the right specialty then, because of course cardiac electrophysiology was such a young specialty that for someone who wants every day to be new and different, that was really the thing to go into, wasn't it?
It certainly was, yeah.
Great.
I really thought that that was going to be the big thing in the future. And of course, it has been very satisfactory for me for my entire career, although I've flitted from one area to another area within that general domain.
So you flitted from topic to topic, but did you have kind of a big overarching plan right from the beginning of what you wanted to happen with your career? Or was that also just something that kind of happened to you?
Well, not exactly, because of course I needed, first of all, to establish myself. That was the first thing that I needed to do. And when I say establish, I mean within an academic career. So I had to become not only a research worker from an NHS position, but then to become a senior lecturer, then to become a reader and a professor, and so on. And I ended up as chairman of medicine at St. George's. And afterwards, I dropped that and went back to just being the chairman of the academic cardiology section. So I wanted to do that, but I quickly decided that I didn't want to go further into the higher realms of university education. And I didn't want either to develop into a full-time clinician, because I wanted to have lots of flexibility and diversity. And I didn't want to sit on committees all day. And I wanted to continue to have some patient contact, but not so much that I couldn't do other things. So I have had a sort of goal to do things and to do things well, but I haven't had anything that I really aspired to be as such. I got to wherever I got, and I think that's quite a good principle, because you don't disappoint yourself if that's how you're going to live your life.
Right. So you just set out really to be the best you could be at everything that you did.
Yeah, more or less. That's been the overriding concept.
Okay. So what did you know that you wanted to do, or maybe you didn't want to do so much international traveling and speaking and, you know, being so well known internationally? Was that part of a goal, or is that something that just happened to you? And did you even want it?
Well, looking back on it, I think I did it too much. But at the time, I very much enjoyed it. And my purpose for traveling was almost always for educating people and myself. So I would go to learn and to teach. And that was the main reason that I traveled. And I found that that was a very enjoyable way of life. Although, and I'm sure you may want to know the answer to this, how did that go with the rest of my family and my life, the fact that I was traveling so much? I did so well that now I'm a life member of everything that British Airways has to offer. And even though I don't travel very much now, I get looked after very well. They meet me and greet me and take me off the planes and onto the planes and all of that sort of thing. I don't know how many times I've been to the moon and back, but quite a lot, I think. But basically, I think that traveling a lot as I did wasn't entirely the best thing for domestic life, because when the children were young, I didn't see them anything like as much as I should have done, and looking back, would have liked to have done. But I had a wife who was a full-time mother and wife. She wasn't working at the time. And therefore, she was able to handle a lot of the domestic duties and a lot of looking after the children and so on and so forth. And I'm glad to say that now, after retired from doing quite so much traveling, I'm a very active grandfather. So I'm very busy with grandchildren and trying to recoup some of what I missed out on previously. So traveling, I think, is important, but it has to be contained. And I would certainly recommend to youngsters that they don't follow my footsteps in traveling as much as I did.
Okay. So the costs were a little high there.
Yeah, I think yes. And you can't be away or go to the airport twice a week, every week, and expect to be able to do as much as at home as one would want to. But in the end, it turned out extremely well. But I look back on it and think I've missed something. And perhaps they miss me as well.
Did anything unpredictable or unexpected happen that kind of propelled you forward, that you didn't plan, or just came out the blue?
Well, I think not in the part of my life that you're most interested in, but I will tell you that the reason that I am in cardiology was through something that was totally unexpected. When I was a medical student in my first year, I developed mumps. And in those days, when young men developed mumps, you were put to bed. So I was advised to go home. And I was in London and I had to go back to North Lincolnshire where my family was, and I was put in bed. And I took with me a book. And that book was Leo Shamroth's book on the ECG. And I don't know if you recall it, but it's that thick. It's a very big ECG book. I was in bed for 3 weeks and I read it from cover to cover several times. And after I had done that, I could never escape from the ECG and cardiology. I tried to be a surgeon. And when I was the surgical SHO, the medical registrars would be bringing ECGs to me to interpret when they were seeing patients in the A&E and so on. So it really was the reason that I had to be a cardiologist.
So this is a different question, but when I was the British Heart Foundation Research Fellow in your department, I recall that we would each of us get about 5 minutes in your office every so often. And during that 5 minutes, it was always remarkable, and you were quite famous for this, I don't know if you know, but you would start knowing exactly where we were and where we were supposed to be after the last period of time and what we were supposed to be doing. And, you know, within 5 minutes, you'd have assessed everything we'd done and made sure that we had enough work to keep us going for at least another month. So I remember those times. And, you know, that was very impressive. So how much preparation did that take? Or did you just know what everyone was doing?
I think I kept an eye on what everybody was doing all the time. So I didn't have to prepare to meet research fellows, for example. I did have a pretty good idea of what they were doing, where they were going, and so on and so forth. So I didn't sit down and look them up, so to speak, and ask around about them. I just met up with them and you, as you remember.
Okay. So, did you ever have a clearly defined mentor?
I did when I was a young cardiologist. I went into cardiology at Guy's Hospital, which is where I had trained. And I worked for two cardiologists there. One was a man called Dennis Ducar, who was a wonderful clinician, absolutely fantastic with his stethoscope and examining patients and so on and so forth. And he was my idea of a doctor type cardiologist. But the other cardiologist I worked with was Edgar Soughton. Now, Edgar Soughton was a much more technical doctor, interested in the latest and the greatest, not only in electrophysiology and so on, but he was the man that introduced cardiac pacing to the United Kingdom and much of Europe. And he was an inspiration to me. And I very much hung on to learning from him how to do research and how to have an ambition about moving forward in cardiology. So it wasn't sort of ancient clinical cardiology. He was always pushing the frontiers. And I very much learned from him how to do all of that. And I remember one incident when we were on a ward round seeing a patient, and the patient had a temporary wire. And Edgar Soughton had been trying to get the administration to buy a pacemaker to put into this patient so they could take the temporary wire out. And the administration said there's no money to buy a pacemaker. So he took the administrator to the bedside and he said, Mrs. Bloggs, meet Mr. Brown, and Mr. Brown, this is Mrs. Bloggs, and you can see she's got this temporary pacemaker, you can see it ticking. And what I need you to do now, Mr. Brown, is to switch off that temporary pacemaker because you haven't managed to buy a permanent pacemaker for this lady. But please tell her that as you do this, she will die. Now, that was a most amazing demonstration of how to bring the faceless administrators to the bedside.
Mm.
I've told it in a slightly more graphic way than it actually occurred. But the point was that he insisted that those who were controlling what we could do at the bedside must join us at the bedside to see what our problems were and how he, the administrator, could help us to overcome them. And I always admired that and tried to do the same myself.
Wow. So, if you were advising a young cardiologist on what to look for in a mentor who would help them to make the most of their own careers, what sort of things would you think they should look for?
I think it depends very much on whether their ambition was to be academic or to be clinical. if it was to be,
Yeah, let's say academic, because that's what you did.
well, I think if they want an academic approach to life, they should find a mentor who has been very successful in that arena, because it's only by talking to people who've had success that you can learn from them how you might be successful yourself. And you do need a moving vehicle to climb onto in academia. If you're starting from scratch, you'll find it very difficult, very slow motion, very hard to succeed. But if you join a team that is active and is very productive, then your productivity will be drawn out and you will be able to fit in and get on very well. So that, I think, is the most important concept if you have academia in mind.
Okay. Do you have a particular strength or trait that you feel was most influential in fueling your success?
I think that my main quality with regard to success is related to my ability to move with the times. Many people develop one skill set and they still stay with that skill set in one area all of their lives. They become extremely expert in that. But I think they also become most of them become somewhat boring in that area. Now, I always wanted to be excited by life. So I wanted to be able to move from one arena to another arena very easily. And that, I think, was what gave me my opportunity. And it isn't easy to do that, because once you get embedded in an area in which you've achieved some success, to abandon that largely and move into another area, you're taking a risk. So you have to have that sort of quality where risks are something that you enjoy rather than fear. And I would recommend that people think about that very much when they're trying to develop their careers.
So as someone prepared to take risks, did anything ever happen that was, really, really bad and set you back in your career? And if it did you learn from that to help you be stronger afterwards, or did it just set you back?
I think I went through a number of dead ends, if you like. I think that's inevitable, but I never got so deep down that blind alley that I saw it as a regretful experiment. I always managed to see that I was going nowhere and moved away from it. So I don't have particular instances that I can quote about that, but there were many of them. And because I didn't get too far off track, I don't recall the specifics of many of those.
Mm-hmm. So is there anything that you wish, other than, so let's say within your career, so not the less travel to be with your family, but was there anything that you wish that you could have done differently?
I don't think that there is much that I regret about the way I pursued my career. I did have a few disappointments. For example, I stood twice to be the president of the Royal College of Physicians. I was third on the first occasion and I was second on the second occasion. My son explained to me that that was top of the losers and I shouldn't be so proud of it. But I tried to be optimistic even about that.
So a third time and you'd have done it, wouldn't you? You were
I
climbing
might have
up,
done, but
second first.
I think that I'd moved on to another area by then. As I've explained to you, I don't sort of stick around if I don't think I'm going to move ahead successfully.
Right. If you were able to spend 2 minutes, 5 minutes with a 20-year-old you, what advice would you give them, knowing what you know now?
Well, I think we're at a particular crossroads with regard to career development, especially within medicine. I think it's really important that you identify an area which will not be taken over completely by artificial intelligence or what have you. I think it's really important to find an area that might be in science, or it might be in the patient interface, for example, in medicine, where artificial intelligence or medicine or other forms of IT will not supplant the human being. And I think that's going to be a really critical thinking process for the youngsters coming into medicine these days. They have to think very carefully about how they think medicine will develop and where they will still be able to make an active and satisfying contribution. For example, I would not encourage anybody to go into any form of imaging now, because I think 99% of the imaging will be done by machinery within a year or so from now. It's going very, very quickly.
Yeah, true. Okay. So where do you get your most inspired ideas? Where do they come from?
Well, I think by accident, usually, often because I've been asked to do something. It might be a simple thing like writing a book chapter or writing a review. And I delve into the literature, for example, and I find something that intrigues me. And I start thinking about it. I think about it when I'm on the underground. I think about it when I'm going off to sleep. I think about it when I'm on my own, for example. If everybody else has gone out and I'm sitting there, I don't switch the television on. I sit and muse about various things most of the time. And I get the ideas, I think, mostly late at night from something that has triggered a thought process, such as writing an article or something of that sort. And I find that that's a very exciting occasion, because you suddenly find something that interests you greatly and you want to do more and more of it. And then first thing in the morning, I will get up early and write a lot of that down. Nowadays, I just dictate it, but previously I would type it into a computer or write it on paper. But now I just dictate it, and I find it's a really good way to get started in any new arena.
Mhm. So just for fun, can you tell me a couple or one really memorable thing that has happened during your career?
Well, the career has been very varied, as I've indicated to you. But one of the things I did was work as a volunteer for the St. John Ambulance Brigade. And I got to be a very senior doctor within the St. John Ambulance Brigade. And we had a message from Buckingham Palace that the people who organized the late Queen and what she did were worried about terrorist attacks. And they wanted to make sure that there was always some medical cover for her. And they came to the St. John Ambulance Brigade to ask if this could be done. And I was nominated to try to develop this. So what I did was develop a scheme whereby in all the high-risk security situations, in those days it was 4 or 5 occasions a year, I would go along to these occasions with all the equipment that was necessary in order to take care of anything that happened to the Queen, if she was shot, for example, or there was an explosion or something of that sort. And I did that in the end for about 25 years, together with other colleagues who I brought on board. And I only gave up in the end, of course, because I realized that my skills at using the equipment I was carrying about was waning, and I had to let some youngsters do the job. But it was extremely exciting because I met the whole of the royal family. I had meals with them, for example. They would invite me to dinner or to lunch and so on and so forth. But most importantly, we did lots of training for the job. And this took place usually on a lonely Norfolk road in the very early morning. And I would be there together with another St. John person, and we'd have an ambulance with us. And in the distance, we'd see a troop of soldiers on horseback coming towards us. And in the middle of this troop of soldiers, there would be a carriage, and in the carriage would be somebody who was representing the Queen. And then the carriage would be moving along, about 100 soldiers before it and 100 soldiers after it, all on horseback. And there would be a shot or an explosion, bugle would sound, and 200 horsemen and a carriage would be rushing towards you. And the first time that happened to me, it was so frightening that the only thing I could do was get under the ambulance to make sure that I wasn't completely run over by this charge of soldiers. It was a very exciting time learning how to cope with all of these kinds of occasions. And that's just one example.
Wonderful. So let's finish this by asking you a question. So you, in case people are not aware, have now retired, at least from clinical cardiology and on the whole new research. So is there anything important that you feel that you started that you're kind of reluctant now because you're having to hand it over to the next generation of cardiologists, an important question that you really would have liked to have had answered by the time you retired?
Actually, I don't think I do have anything like that, because I think that I've not, quotes, retired, but I've moved on to something else. For example, now I spend a lot of time developing educational material. One thing that I'm really involved with is the European Textbook of Cardiovascular Medicine. This is the European Society of Cardiology textbook, and we're developing the 4th edition at the moment. And this 4th edition will have 1,000 contributors, for example, and it will be essentially an online educational hub. And it's a really exciting thing that we're doing, putting all of this together. And I just feel that you must concentrate on what you're doing right now and not regret leaving anything behind, but continue to push ahead.
Wonderful advice. Thank you so much for your time.
Thank you.
And for your wisdom. Thank you. Okay. I'm going to stop recording.